You guys all right to go? Thanks for joining us at what is a very difficult announcement. None of us want to be in a situation where we have to lock down again, but this Delta variant moves so fast that with even a handful of positive cases that can't be linked and that haven't been in isolation throughout their infectious period, there is no alternative for us but to listen to our public health experts, take their advice and make the decision, the very difficult decision that my Cabinet colleagues and I have just made on advice, and that is that Victoria will have to lock down again for 7 days from 8 p.m. tonight. 5 reasons to leave home, school closed, all the same reasons, all the same rules that we are well accustomed to, that we have used to our collective benefit, that we've used to crush outbreaks a number of times, even Delta outbreaks. But the fact of the matter is we have 8 cases, 6 reported this morning and 2 further cases on the board that would normally be reported tomorrow, and only 3 of those can be linked to a known outbreak. The rest we have to assume are what they appear to be, mystery cases, where we don't know how they got it, we don't know who they've given it to or how many people they've given it to. Now, nothing I say today is meant as a criticism of anyone else across our country, but context is very important. I want to make it very clear, we only get one chance to act fast. We only get one chance to make difficult decisions that are the right decisions. I'd much prefer to wait 2 or 3 days. I'd much prefer that we didn't have to make this decision now. But my fear is that if we were to wait a few days, and the advice to me from the experts is that if we were to wait even just a few days, there's every chance that instead of being locked down for a week, this gets away from us and we are potentially locked down until we all get vaccinated. And that's months away. Others are living that at the moment. Others are having to deal with that at the moment. We wish them well and we're supporting them, but we do not want that here. I am determined to do everything, popular or otherwise, to avoid that happening to us. We've been through that long lockdown. We did that last year. We don't want to go back to that. And that's why these decisions are absolutely critical, and it's why we've made them as tough as they are. It's why we have made these decisions, and it's why I'm announcing them now. Now you might ask, why not midnight tonight? Why is it effectively a snap lockdown? Well, the Miss Frankie's outbreak cases, there was transmission on the night of the lockdown last time. So this evening is go home. Go home and begin that lockdown. Don't be out and about, because all you might be doing is spreading this virus. Now, we'll go to questions in a moment, but you've got a document there that takes you through all of the rules. They are essentially the rules that applied last time. They're well understood. They have been very successful. They're painful, they're difficult. We wish it wasn't this way. I can't tell you how disappointed I am to have to be here doing this again. But with so few in the community with 1 vaccination, let alone 2, I literally have no choice but to accept advice and collectively to make this important decision to keep Victorians safe. The alternative is we let this run. It gets away from us and our hospitals will be absolutely overwhelmed. Not hundreds of patients, but thousands. And not just COVID patients missing out on care, and not just COVID patients dying, but of course people who need intensive care, who need critical care, urgent care in our hospital system, and an overrun hospital system will mean stroke patients, cancer patients, people who've been in motor vehicle accidents, premature babies, all of those who need that care, well, they'll be compromised as well. We just can't allow that to happen. If anyone watching this doesn't think this is relevant to them, well, I would make the point that we've all got relatives, we've all got family, we've all got people who are vulnerable for one reason or another. But then I would also make the tragic point, a person in their 20s, a bloke in his 20s died yesterday in Sydney. This is relevant to everybody. Nobody wants to get this. Nobody can afford to ignore this. No government can refuse to accept advice and act to do what's right. And that's what I'm doing today. That's what our government is doing today, as painful and as difficult as it is. Now, we can't change what's happened in the last few days. We'd much rather not have these cases. And again, I'm not here to run a commentary on any individuals. But every day and every case, every outbreak serves as a set of important reminders. So with respect, and nothing else, just with respect but a sense of urgency, can I plead with every single Victorian? If you have symptoms, then with so little cold and flu around, if you've got symptoms, you've got COVID. That's what you have to assume. And that means you've got to go and get tested. Don't wait an hour. Don't wait an afternoon. Certainly don't wait days and go to work in the intervening period. You can't do that. That's no good for you. It's no good for the people you love. It's no good for the rest of Victoria. It's in fact very bad. Please go and get tested as soon as you register symptoms. Please follow the rules. We'd all love to be visiting family and friends. Some people have been visiting family and friends, and all it does is it spreads the virus. So I just to say, not any group, not any part of Melbourne, not any particular community. I think there are many people who are perhaps not doing as they should. We're all tempted to do that, but we just have to find it within ourselves to do the right thing. So I would plead with all Victorians, please don't be going and visiting family and friends, because you might well be contributing to the spread of this virus. And that won't be good for your family and friends. It won't be good for any of us. The rules are there to keep us open. And if we follow the rules and we keep working hard as a community, and our contact tracers keep working hard as they are, not just meeting but exceeding all the national benchmarks, then we will bring this under control and we will be well placed to avoid another one, another set of cases, another lockdown in the future. But one thing is certain, if we don't follow the rules and if we don't make difficult decisions, then there is an alternative, and that's where cases run wild and no contact tracing can pull it up. Each day it gets worse rather than better, and then you're locked in until we're all vaccinated. And that's not happening next week or even next month. That's happening in many weeks' time. I'm determined, and I believe we have every chance of being open for the vast majority of the time between now and when we're to 80% of people have had the jab. That is absolutely doable, but we've all got to play our part to achieve that outcome. I can't guarantee that, but I can certainly be clear with Victorians that if we don't follow the rules, if we don't stick together, if we don't have that sense of common purpose and be as stubborn and as determined as this virus, then we just look to what's happening in other parts of the country, and that will happen here. And we don't want that. So that's why these difficult decisions have been made, and nothing about this is optional. This is a lockdown. It will be enforced. It's for the best of reasons and the best of purposes, and that is to bring these case numbers down under control so that we can once again be open. Just finally, before we go to questions, the Treasurer and or the Minister Pallas and Minister Pakula will be out tomorrow, as early as tomorrow, to make some further announcements about business support, as we know this will hurt a lot, and we'll look to make those payments as quickly as we can using that automatic payment function that we've used before, and we would look forward to another strong partnership with the Commonwealth Government, just as we did a few weeks ago, last week in fact, with a 50-50 split on additional support. We would be confident that the Commonwealth Government and our government can continue to work together positively to support those affected businesses. Sorry, I did say finally, but there is one more point to make. Why is this in regional Victoria when the cases are predominantly in Melbourne? Well, we have a sewerage test that has detected COVID in the northeast. So the Wangaratta sewerage test has pinged, if you like, firstly positive, then it went negative, now it's gone positive again. So we have some reason to believe that there is COVID either in that community or has been in that community. We saw last time, only a few weeks ago, this went from Melbourne into Balan, Bacchus Marsh, Barwon Heads, all the way up to Mildura. We all have to work as hard as we can to avoid this spreading any further than it already has. But I don't get the luxury, we don't get the luxury of assuming that we have all of the knowns, that we know everything about this. We've always got to assume there are more cases out there than we have positive test results. and with one sewerage detection, we have to assume that there are cases. So that's why it's statewide, and I think as painful as it is, and as counterintuitive sometimes as it is, we don't want this taking a hold in country Victoria. We just don't. None of us are happy to be here, none of us. But these are the realities we face, and none of us have the luxury of ignoring them. I'm happy to take any questions you have.
Should Victorians now accept that until we do get that vaccination level, snap lockdowns with just a couple of cases are the new norm? And just a further question, is the 7 days required, or is that so that after 3 or 5 days, if that was to be announced, you didn't have to extend it again? 7 days? 7
days is the advice, and we follow the advice. I think it is unlikely that we would bring that forward, but we'll review it every single day. I'd hope not to have to extend it, but again, we'll be guided not so much by what's politically convenient or popular. We'll be guided by what the science tells us. What is the epidemiological picture each day, each hour, over the course of the week? What story does that tell? And hopefully it tells a story of, yes, there are extra cases, but we find them quickly. Their close contacts are locked down fast. We test, we trace, we isolate, and then we can quarantine people. That's the strategy. I just make the point that the notion of snap lockdowns being the new normal, the pre-vaccination normal, this infill period between now and whenever we get to 70 and then to 80%, that's not just Victorian government policy or my policy. That is endorsed by the Department of Treasury at a national level as being less costly to all of us in the long term than being locked down for months. It is also supported by the Doherty Institute, one of the world's most preeminent infectious diseases research institutes, in their modelling that they presented to National Cabinet last week. And just finally on that point, it is the National Cabinet endorsed position. And I thank the Prime Minister for his comments, very clear comments today, where he had confidence in our capacity, confidence in our decision making, and confidence in the framework that we would use to come to this very difficult judgment today.
But what's the medical advice supporting 7 days? Why not say 3 days or 5 days? Why the full 7?
Well, given where this is, given that it's not just one mystery case but potentially 2, we think that we may need as long as seven days. We'll monitor that every single day. I don't want to be here, Julia, foreshadowing or giving people false hope that it's going to be on Monday. I'm going to be standing here saying it's all fine and we can open up again. I think that is not going to happen. 7 days is what we believe is necessary, but let's hope that is accurate. We'll all be working as hard as we can to make sure that come 8 p.m. next Thursday we can be out of this. Can I say though, each of us have a part to play in this, and if we follow these rules, if we take this lockdown seriously as we always have in the past, if we see a very high degree of compliance, and if we see people who are asked, and it may well be tens of thousands of people who are asked to stay at home and not leave their home for any reason, if we see them doing the right thing and being really disciplined about this, then there's every chance we can bring a sense of control to this. But it's one of those things. I want to be confident, I want to be sending a positive message, but I've got to be honest with the Victorian community. We all have to play our part, and I can't with any certainty say where we'll be tomorrow, or in 3 days, or in 7 days. All I can talk about is what the advice is and what we're going to work towards achieving, and that is an end to these restrictions in 7 days' time.
Have any new cases been detected since we last spoke?
There's 2 on the board, and no further cases beyond that, and I can't give you any details on them because they'll still be going through the interview process now.
Did we come out of lockdown 5 too early?
There are no alternatives to lockdown. If you wait, it'll spread. And once it spreads, you can never even hope to run alongside it, let alone get out in front of it and bring it back down to 0 or a low number of cases. This thing moves so fast. This is now settled. There's no debate or discussion about this. The Delta variant moves at lightning speed. And by the time you get to people, they've already infected all the people they live with, all the people they work with, all the people they've spent time with. We can't allow that to happen. Otherwise, we're locked down until Christmas. We're locked down until we get 80% of people through the vaccination program. I don't want that. Let's try and do everything we can. Surely we can agree. Let's all try and avoid that. That's what this lockdown's about.
Did we come out of lockdown 5 too early, given that we still have...
Well, the question is, look, I'm not for a moment standing here saying I'm pleased that this is the only option. I'm not. I wish we weren't here, right? Whether it's sustainable or not, you've got to think what is the alternative? Like, to be really frank, we don't have enough people that have been vaccinated, and therefore this is the only option available to us. Once people are vaccinated, then we have many more options to the question about were there other things you could do. There will be. The time will come when we have got many more options, but that isn't now. You've got to get to 70%. You have some more options. 80%, then we're into a different world. It's not 100. It's not easy. Like 100% is where you really want to get to, but we all acknowledge we won't get to that. But 80% is a minimum. If we can get up above that, and I'm confident we will, then the world is very, very different. But we're a long way from that now. We're not certain of that. When we are in a position to shed more light on the circumstances behind any of these cases, we will, as we always have done. Well, I would simply say that I've tried all the way along to never say or do anything that would discourage people from coming forward and getting tested. And if we're going to, potentially have an entire state's blame and anger focused on one person, I don't think that sends a very good message. As it might make us all feel better for a short period of time. So I won't answer in the specific, but in the broad, let me make this point. You cannot feel ill for a day or two and then go and get tested. You just can't. You've got to go and get tested as soon as you feel unwell. As soon as you have any of those well-known and well-understood coronavirus symptoms, I'm appealing to every Victorian. Please go and get tested so that none of us have to be in this position again as a state. It's critical. In fact, nothing's more important. You get symptoms, you go and get tested. And it's like within hours. We're getting results back really fast. The queues are not that long. We will get you through as fast as possible. And you will have done something profound, something genuinely profound for your health and safety and for the safety of everybody.
So did this teacher case do the wrong thing by working when she was feeling ill? Is that
Well,
your understanding?
again, I'm not here necessarily to. Well, sorry, I think we're still unable to necessarily confirm, and it's not been my practice to be calling out individual behaviour. But what I want and what we need, which is more important than what I want, what we need is for people, if they've got symptoms, they've got to get tested immediately, not wait 4 or 5 days. That doesn't do anybody any good. But we can't change that. We can't change what this person did. We can't change the choices that this person made, but we're very grateful to this person that they are working with us and telling us a full story. Rather than punishing them for that, I think we should always encourage people to be upfront. The value of the information far exceeds any fine or the contribution that the information makes to us getting out of this and opened up again is far more important than any of us feeling, happy for a short moment if we were to, be out there criticising this person. I don't think that necessarily helps. The most important thing is, if you're asked to isolate, you must isolate. When the rules say you can't visit people, no matter how much you love them, you can't visit them, then you can't visit them. And when I ask you, and when doctors ask you, and the whole system asks you to test as soon as you register symptoms, it's for you and every single Victorian. And that's why we would appeal again. You've got to get tested as soon as you register symptoms. Not go to work, not delay for an hour, let alone an afternoon or 4 or 5 days. You just can't.
On Richard's earlier question, though, about an illegal party, is that a theory that you're actively investigating?
There'll be lots of different theories that are being actively investigated. The reason it's a mystery case is that multiple mystery cases here is that we can't pinpoint. We don't know. The better thing, rather than me theorising, and if I might suggest anyone theorising, let's wait for the genomics, which will come to us hopefully tonight, if not tomorrow morning, and we will then be hopefully in a much better, much clearer sense of where this has come from. That's why we do genomic testing. Well, hang on. What I'm saying to you is there is a fine balance to struck between holding people accountable for actions that we can't change. They've already occurred, we can't change that, and essentially building in a disincentive for people going and getting tested. If people are fearful that they will be held accountable and fined and all of those sorts of things, then they perhaps won't come forward and get tested. Well, again, this is the position we're in. Like, is it perfect? No. Does it make complete sense from every perspective? No. But I can start issuing fines to people, right? And then people will not come forward and get tested.
But Premier, how many more?
And then we'll have more, and well, but
people are fined for doing the wrong thing.
But, well, and look, the key point here is we need to track and trace these cases. We need people to be truthful. I don't think they necessarily will be truthful if they're under fear of multiple $1,500 fines for telling their story and allowing us to track and trace and close the thing down. The easiest thing is to say, let's just throw the book at these people. Well, that won't change case numbers. We'll probably drive them up and we'll still be locked down. So what's the ultimate enemy here? A small number of people who've done the wrong thing, or the virus? I think the virus is our enemy and we need to be focused on that. Now, I know it might make us all feel better for a short period of time if we were to, go after some of these people. I can't change what they've done. I can only appeal to people and appeal to Victorians to make decisions that aren't. It's not about making decisions that are in my best interests. It's about making decisions that are in your own best interests. No one wants to get this. People want to be out of lockdown as quickly as possible, and the best way to achieve that is if we all work together and we just follow these basic steps. You can't be going out and about if you're sick, get tested if you're sick, and do nothing else. If you're asked to isolate, please isolate. And the rules prohibit visiting family and friends in their home for good reason, because as we see here, it can do nothing more than contribute to the spread of this virus and add to a lockdown. That's not what we want.
Are you suggesting that the teacher case visited family members who are now infectious? So that the football case visited families who are now infectious?
I'm indicating to you that none of those matters are necessarily settled, but we are looking at a whole lot of different information that's provided to us. I'm being as upfront as I can be with you. And I don't think it's just these cases. I think that it's fair to say, and all of us will know people in our own circles, in our own lives, who are potentially not necessarily following the rules. And I'm not making judgments. I know it's hard. It's very difficult. We're well into this. We all wish this was over. So before you go and write columns about how I'm blaming people, I'm being honest and frank. I don't care what you did yesterday, right? But you can't do it today and tomorrow. You've got to stop doing that. We've got to follow these rules for the best of reasons. It's not about making judgments. I know it's tough. I know that, after 18 months, people can convince themselves of a lot of things. Oh, it'll be fine. I can just duck over to my son's place. I can just duck over to friends, family, whatever it might be. The rules are there for a reason. To keep us open, to keep case numbers down, and to keep people alive. As I said before, I wish I couldn't quote this, but a bloke in his 20s died in Sydney yesterday. This is not something that's happening on the other side of the world. It's not something that only happens to very frail old people or people who are who've got, poor health. It can happen to any of us. That's why getting vaccinated is so important. But we're not there yet, and that's why we have to fill this time. We have to fill in this intervening period with a renewed vigilance, looking out for each other and being determined to continue to make these sacrifices so that we can prevail against this thing and not have it win out.
Should Victorians be blaming then the New South Wales Premier for this latest two lockdowns, really, if you've got to blame anybody?
Well, to be honest, I don't think blame necessarily works against this virus. And I'm not here.
On their behalf, was it not?
Sorry?
Was mismanagement on their behalf, was it not?
No, you can make your own judgments. I'm not here to talk about New South Wales other than to paint, I think, and as I said before, nothing I'm saying today should be taken as a criticism of what's happening to our north, but I don't think you can have a proper discussion about the decisions we've just made without referencing what's occurring in Sydney. We don't want that to happen here. We've been through that already and worse, and it's not about, I wish to Cameron's question before, I wish there were 5, 10 other options and there's a different lever you could pull, but there isn't. It's either this thing, because it moves so fast, it's either lock it down and get the cases down to 0 or close to it, 0 in the community certainly, or it runs wild, it gets away from you, and there's no pulling it back. No one is more upset to see cases in Sydney going up than me, because their problem is our problem. A problem anywhere will be a problem everywhere for our nation, because we're not vaccinated yet. That's going to happen, but it's going to take time. And in the meantime, we have to keep this thing at bay, function as much as we can, but we just can't have a situation where our hospitals become completely and utterly overrun. And look, again, not to be criticising or to be obsessing with Sydney, but if they opened up tomorrow, their hospitals would be overrun in a matter of days. We don't want that to happen here, or anywhere for that matter.
Given the effectivity of the Delta variant,
Yes?
is it possible that maybe we jump the gun and ease restrictions a little bit early?
No, I think that we looked at all the cases, we looked at all the data we had, we looked very, very carefully and closely. There's no confirmation that these mystery cases, the reason they're a mystery is we can't link them back to the outbreak. It may well be that, and I won't make a judgment about how likely or unlikely it is, but it may well be, it's more than possible, that these cases are not connected. You know, we're looking at some links to some people who have come to Victoria out of New South Wales hotel quarantine recently. We're looking at every possible connection, and it may well be that these cases, the mystery cases, are not connected to the outbreak that we've just dealt with. They are a separate issue. You know, we have many people who are here on red zone permits. One of them may have turned positive. One of them may have turned positive and not necessarily stayed in their house the entire time. There's many different options here. Genomics will help us clarify it, further interviewing and casework, all that stuff the contact tracers do, and they'll be doing it all night tonight and tomorrow, and for, you know, every day they need to. That may well give us the clarity that we're after. But no, I don't think that's the case at all.
Are you able to go into any of those lines of inquiry in more detail?
No, I'm not. None of us are at this point. But there will be a time though, and genomics I think will be.
Why mention the New South Wales hotel quarantine case because it's so unadvanced that you don't...
No, it's not unadvanced. No. I would have thought, Paul, you've worked out. I choose my words very carefully, and I'm saying it because I know it, and it's a fact. Whether it bears out, I'm not saying it's absolutely 100% what's happened, but it is a line of inquiry. It is a genuine line of inquiry. So let's not, I don't want to be rude in any way. If I say it because I wouldn't want you to later on come at me and say, you knew that, why didn't you say it? So it's about being as frank as I've always done this. I've always been as frank as possible. Doesn't mean you like what I say, but I've always been frank. So that is a line of inquiry, but I can't go into any further detail because it's not settled yet. It may come to absolutely nothing, or it may well be the cause. We just have to work this through.
Premier, for the sake of transparency, what evidence do you have that that's from hotel quarantine?
Well, hang on, there's
Some
no.
details need to be provided if this could possibly...
Yep, there's a couple of people that have come back from Sydney. They were in hotel quarantine, and it may well be the case that they've been visited against the rules by someone who is a positive case. Whether they got it from them, whether they've even got it, we have to wait and see.
So we know that it visited them. We're just trying to confirm whether the New South Wales returnees were positive.
Yes, and there's probably a few other unknowns in that as well.
Just a related question. At the Canada report coming out of lockdown last week,
Yes.
we had a positive wastewater inspection in Highlight Springs. We
Yes.
also had the mystery case at the Inverlow Testing Centre.
We did.
Were they two warning signs that we possibly should have taken more notice of in our case for the lockdown?
Well, I wouldn't say that there was a haste. We had extended the lockdown. The lockdown ran longer than it was supposed to. And no doubt there's a lot of people had a view about that. Would have much preferred it to be shorter rather than longer. I wouldn't want any Victorian, you guys or any other Victorian, to be in any doubt. The public health team pore over all the data. There are multiple meetings. It's one of the, going into a lockdown is an incredibly difficult decision. And formulating the advice that underpins that is not easy, but working out when you can safely come out is also a very involved process, a very deliberate process. I wouldn't want anyone to think that those judgments are made in haste. They're very difficult judgments, and the only way to avoid them, I suppose, would be never go into lockdown and have your system overrun, hospitals overrun, or never come out of lockdown, and I don't know that that'd necessarily work either. So it's just one of those balancing acts, but I wouldn't say it was a hasty decision. There was one that was thought about long and hard, and I would just note the lockdown was longer, substantially longer than it had been planned to be, because the cases justified that. There are a number of close contacts that are public housing residents, and we'll be supporting them. I don't believe any of them have turned positive yet, but we'll be supporting them. There'll be a number of people who will, because it's not possible to isolate and share a house with somebody. You know, we may well have to house many more people in our CQV hotels rather than having them quarantine at home or isolate at home. I just want to be clear, I've not made this decision yet, but if I have to make the decision to suspend flights, I will inform the Prime Minister of that, and we will use that hotel quarantine capacity to support locals who need somewhere to sleep. They need somewhere to stay. Because if they were to stay in their family home, they would likely infect everybody else they live with. So that's on the table and something that we're looking at closely. Common sense will prevail. Police and authorised officers are not going to be out there, you know, booking people and issuing fines for people who, you know, can't be back home and comply with these orders by 8 p.m. But people are expected to make best efforts to comply. But if you're at the other end of the state and you're driving back and you're not going to get home by 8 p.m, we would ask you, and you are required to, in good faith, do your level best to comply with the orders once they come into effect, which will be at the stroke of 8 p.m. tonight. Certainly. So I've spoken about business support, that'll be forthcoming tomorrow, and there will also be, and in terms of personal support, whether it be counselling, mental health support, all of drug and alcohol, all of those services, we've boosted those consistently throughout the global pandemic, and we will again look to bolster those services. It stands to reason that they'll have increased demand at the most difficult times, and this will be yet again another lockdown, a really tough time for a lot of people. So we stand ready to support them, but unfortunately there is every chance, in fact it's almost certain, that if we didn't make these incredibly difficult decisions, then we would finish up in an even worse position in only a matter of days. That's how fast this thing moves.
AFL games coming in this weekend?
They have no crowds at them, and I think there is a professional sport, so it's about work. So I don't believe your note doesn't have anything different, so I think it'll be the same as last time. Sorry? I wish we weren't here. I wish that, you know, the food and wine capital of our nation, the live theatre, arts and culture capital of our nation was open 100%, 110% for business. That's my wish. We don't get to enjoy that at the moment. The alternative is that instead of being shut for 7 days, we're shut for 7 weeks or even longer. I don't want that. I'll do everything I can to avoid that. I know it'll be very tough tonight, very tough, and tough for the next 7 days. That's why tomorrow, so at the earliest opportunity, there will be a significant package of business support, and we will waste no time in pushing that money out to those who are eligible, and that will be people who have received payments in recent times. They won't have to apply again, no paperwork, they'll simply get the funding, and that'll make a contribution to them getting to the other side of this.
You emphasised the Miss Franklin's
Yes.
Miss Franklin's experience last time.
Yes.
We know that almost all transmission occurred before the last lockdown was called.
Yes.
Like quite a lot of
Yeah.
How much did that inform the speed of this decision? And just on that, are there key kind of sites that the public health team have identified this time around where transmission probably occurred in the last few days where we might see cases pop up from?
What I would say to you is it's now not just a Victorian approach, it is the National Cabinet agreed approach. you almost can't go too fast. You almost can't act fast enough, even if you do it, the very day that you get positive cases. And what experience shows us the world over is that if you feel like the government might have acted a bit too quickly, chances are they've got it exactly right. That's what the international evidence shows us, and it's what our own experience shows us. And as you rightly point out, it's in the period when you're not locked down that you will get the majority of cases. That's why locking down quickly works, because it shuts off those chains of transmission really early, and in fact prevents a whole lot of them ever starting. In terms of venues, what I can say at this stage, homes. That would be, none of us needed convincing or needed reminding of how high risk home environments can be. I think that off the early information we have, we would say that we've been right to be concerned about that all this time, and that's why I'm appealing to every Victorian. Please do not go and visit people in their home. Please don't have people to your home. All you may be doing is spreading this virus and seeing us locked down for longer. We don't want that. We just don't want that. And we can, together, make that less likely if we just all follow the rules. And no visit to someone you love is worth all of us being locked down for days and days and potentially worse.
Teacher was positive yesterday. How long is it going to take to get this notice back for that?
I think we're getting it tonight. I believe we're getting it tonight.
For you personally, do you feel kind of mental anguish at having to do this again? Do you somewhat have personal doubt and think, can we actually do this again? Can the people do this again? Does that factor into your decision making ever?
Look, these are very challenging times for all of us, and I haven't got the option of doing anything other than following the advice I'm given, particularly when I know that it's advice that has worked and will work again. Am I gutted to have to stand here and make these? Of course I am. I would much prefer, as much as I enjoy your company, I would much prefer not to be here now having to make these difficult announcements. They are incredibly painful, they are incredibly difficult. But the alternative is not being locked down for 7 days, it's being locked down for 7 weeks or more. Locked down till we get to 80% vaccination, and that may not happen until almost Christmas time. We have been through a 3-month lockdown. That was 2020. We don't want that again. And this Delta variant just makes it so hard for us. There's no other option. If we had other options, we would use them. I think Victorians know that. In terms of how I feel, it's incredibly challenging, but you've got to stand up and make the right decisions, and that's exactly what we've done. We'll have some advice. Sorry, Rich, you asked me this morning. My answer hasn't changed. This morning and last night we were very close to making announcements. We remain very close to making announcements. That timeline hasn't changed, and I think in the next couple of days we'll be able to share with the community a new way to get access for many tens of thousands of people who can safely, after a consultation with their GP, they can give informed consent and they can receive the AstraZeneca vaccine. That's what we want to happen. We've got pretty significant stockpiles, and we want to use that. We want to push that out for those who've been to see their doctor, have made an informed choice. We want that to happen, and as how that will work in state clinics, we'll have more to say about that soon.
They'll get it at the heart.
Well, there's always a good time to get more people vaccinated. This is even more important. The other point I want to make today, and I'm not, I've always been about, wherever the greatest need is, that's where the greatest support should go. But I have to say, I was a bit surprised to learn of all that extra Pfizer going into New South Wales. We hadn't been told about that, but that's fine. They've got a greater need. Give them a greater amount of Pfizer. I'm told that there's also some additional supplies going into Queensland, and on the back of that, we've made a request for a bit of extra to come to us.
How much more?
Not sure actually. We'll be working through that with the Commonwealth, and perhaps if we can confirm that for you later on today or tomorrow, we will.
And given as well that
We don't want to make a request that's got no chance of the answer being yes. So we'll just work that through. I will note though, I did ask for about 7,500 doses last week so that we could 50-50, half from us, half from the feds, to do all of our supermarket distribution centres so as to keep food on our shelves and food on the shelves of supermarkets across the whole nation. That wasn't available, so we're doing that on our own, and we're quite well advanced in our planning. But any additional doses is a good thing. And to Rich's point, getting more AstraZeneca out through our state clinics, that's something we'll have more to say about soon.
And also, given that we've seen deaths of some young people due to COVID over the last few days,
Yes.
do you think that it's time that we open up Pfizer, the supplies that we do have, for all young people, given that there seems to be a big demand there?
Yeah, look, there's not only with the tragedy in Sydney and the hospitalisation, I'm not an epidemiologist or a virologist, but the virus will go where the vaccine isn't. So it stands to reason that you finish up with more people who aren't vaccinated becoming unwell. It's also, I think, true to say that the greater transmission risk is from those who are moving around more. They have more close contacts. They're moving about different environments more. I wouldn't want, and again, I'll let the Prime Minister and Minister Hunt and General Fruin speak to this, probably they're better qualified than me to talk to it, but I wouldn't want anyone to think that cohorts were being denied out of choice. It's just about how much we've got. And Julia, I think there's probably 100 different, maybe 1,000 different groups who could mount a case. You know, we've heard about teachers, we've heard about kinder staff and educators, we've heard about supermarket workers. The list goes on and on. They all make a really good, strong case. Problem is, we haven't got the stuff. We haven't got the warehouses full of this stuff, and we're not likely to have that until September, October, November.
I mean, as an idea, should it be a free for all? Should you be able to have access to it, regardless of your age?
Well, I think that the cohort-based approach has served us well, and, you know, the fact that you don't have this running wild through private sector aged care in Sydney, as it did here, and you therefore don't have all those hundreds of families having to deal with the tragic loss of a loved one, a burden that they still in our state carry today, that is a testament to the decisions made to vaccinate the frail and the elderly first. Now we're moving into a different phase, and I would say to you, rather than us sort of trying to will more Pfizer here, I think having a conversation with people that's medically led, that's got efficacy from a clinical point of view and is safe, let's push more of the AstraZeneca out to younger people, because it's safe to do that. And we can, because we've got stockpiles of that. And as I said, it's a bit frustrating. I can't announce it right now because it's got to be done properly, but it will be done very soon. We'll be back very soon to announce exactly that. And hopefully from next week, we can have some new settings that'll see many more people vaccinated. 5 kilometres. If you hope this, if we all hope, as we do, we hope to have these restrictions off as soon as possible. They not only have to be fast, they have to be quick. Not only does it have to be a snap lockdown, but it has to be a harsh lockdown, and that's where the 5Ks comes from. That's the advice we've got. It's what we believe will work, and it's what we've endorsed. Not that I can update you on, but we're happy to get back to you.
I know it's late.
It was yes, no, and then yes again. So it's quite recent, and I think there's some in Caroline Springs as well, but we'll come back to you, Rachel.
And I guess there are a lot of parts of regional Victoria that are a long way from Wangaratta.
Yes.
Still getting locked down. How do you justify not being those?
Well, there are a lot of people that would have said that Mildura was a long way from Balan, Bacchus Marsh, South Barwon, a long way from Melbourne, a long way from the MCG. Turned out that it wasn't though. Yeah, sure. And there's, and at this stage we have to assume that the same thing has happened, because you only get one chance to assume that, and if you make the wrong call, then it'll finish up, almost certainly it'll finish up in regional Victoria, and then we've got all sorts of problems on our hands. And I think that the people in Mildura who did an outstanding job, I think it is, there's an extra degree, it's quite traumatic and quite challenging to have this visit your community for the very first time. We don't want any more communities in regional Victoria to have to experience that. Pretty tough bunch, and they did a great job, but this is the right choice to make now, and I'm sure that there'll be others who'll say, you know, for their own political reasons, no, it should be more targeted, it should be more bespoke. We tried limited lockdowns last year. It didn't work. I'll leave you to judge whether targeted lockdowns in other parts of the country at the moment are working. You can make those judgments. I'm following the advice of our experts, and that is that it's all in for 7 days. And if we all work really hard, we can get out of it.
I know we want to get out of here. Does Jerome have any
No, it's okay.
new detail on either any of the cases? And then, do you have any new detail on any of the cases?
Can I just ask a friendly one more question? if I
Sure,
can?
no worries. Yep.
Is ongoing days of zero local COVID cases an unrealistic target now that we have the Delta variant?
No, I don't believe so. We may have ongoing cases, not just of zero. We could have ongoing low numbers if they were not in the community, if they've been isolating. But it is incredibly challenging, I think, to remain open and have the Delta variant kind of bubbling. It doesn't bubble, it just rages. It goes anywhere it can. And if you're open, then all we do is, all of us, knowingly or unknowingly, we all contribute to spreading it.
That is the goal, is it not?
It will, well, it's the only thing that, well, the goal is to actively suppress through testing, tracing, isolating and quarantine down to zero in the community. You could have cases that were not in the community, and look, if there were 8 cases today but they'd all been tucked away and they hadn't been near anybody, we wouldn't be standing here. The problem we've got is that 3 are in that category. 5 of them, we can't work out where they got it from, or if they got it from each other, there's at least two of them that got it from somewhere, and we can't work out how or where or when. And that's where you get to this position where you have to assume there's more of it. So I think 0 is achievable, and I think low numbers are maintainable, but I don't think there's not, until you get to 80% of the community that's had the jab, the notion you could have 20 or 30 cases, like you'd only have that for a day or two. Then it's hundreds, then it's thousands. And that's a very challenging set of circumstances for our nurses and our doctors and our ambos and our cooks and cleaners in our hospitals. Just, you know, if you're unconvinced by anything I've said, perhaps we should organise a couple of our health professionals to come and talk to you that dealt with our second wave last year, which was not Delta, but it did involve many hundreds of people who passed away and many hundreds of more that were in hospital. And those nurses and ambos and doctors and the whole team tell me some horrific stories of just how challenging it was to nurse and to care for people. We can't go back to that. We just can't, particularly with Delta, because it'll just be everything times 10. We got through this last year. There was, months of learning from home. I'm not for a moment saying it's easy. I've got a year 11 and a year 9 at home, and they'll be learning from home tomorrow and for the next 7 days. It's very challenging, but I think we are up to this task. We've done it before, we can do it again. To parents, I thank you in advance for the sacrifices that you'll make and how tough it'll be. And to our teachers and staff, I think we're in awe of the job they did last year. We have done this before. We will get through this again. If I had other options, I would use them. I simply don't. I must follow the advice I'm given, and the best advice says the only way to pull up a Delta outbreak is to lock down hard and fast for 7 days. If we all play our part, then we can get past this and be open again, and then work as hard as we can to vaccinate everybody as fast as the Commonwealth can provide us with vaccines, and then look with a sense of optimism and hope to a different time, which will be predominantly the very last moments of this year and hopefully beyond.
Did you say last year when we reported 725 cases, what's changed and what hasn't?
Well, we've got a brand new strain, and I think you'd get to 725 cases not in months but in days if you were to let this go, if it was to get out and get beyond you. I think that, as every Victorian would want us to, we've learnt from every case. We've improved after every outbreak. It's a constant process of improvement. And we now have, instead of some of the bickering last year, some of the sort of politicking, we now have the federal government completely aligned with our strategy, and it's now agreed. It's no longer a point of political contest about what is needed. And no one enjoys lockdowns. But what's worse than a 7-day lockdown? One that runs for 7 weeks. And I'm going to do everything I possibly can to avoid that.
And just in terms of restrictions, there was a change made between weeks 1
outside work. The outside work. We've gone back. Outside work is not included. We've gone back to the original, so it is as per the first set of rules. When we made the extension, you're right, we did do some easing. There's some specific provisions for kids with disabilities, vulnerable children, and kids of essential workers. All of this will be up online. All of this will be there for people to look at, and we're grateful to each of you for the part you play in helping us to get these rules and these messages out. I'll say it again because I literally cannot say it enough. If you're sick today, right now, you're watching this and you feel you've got any COVID symptoms, go and get tested tonight. Testing facilities are open. Stay away from everybody else till you get your results. And this is the final thing, and I'd be grateful to each of you if you can help us push this message out. If you don't have resources to fall back on and you need to get tested and stay away from work for a day, we will pay you $450, no questions asked. Because you staying at home is worth so much more than $450. So if you're a casual worker, and if I don't work, I don't get paid, then isolating could cost you a shift. Well, no, it won't, because we will give you $450. Secondly, if you are positive or you are a close contact that has to isolate for 2 weeks, we will give you $1,500. So no one in Victoria has to make that choice between feeding their family and doing the right thing by the rest of us. Everyone can do the right thing by the rest of us, including their own family. Stay at home, follow the rules, isolate, test, all of that, because we stand ready to provide you with support, and we have done that for thousands and thousands of people. And we might get a neater way of saying it than I just did, and if you can help us get that message out again, that would be very, very useful.
What are the rules around elective surgery?
There's no change to elective surgery, so it'll continue as it did last time.
And can I just clarify, are you specifically investigating on today's case whether the positive testing from the worker ended up with the teacher?
We're investigating all manner of different things. Let me come back to you if you. I don't want to make something up. Let me just take that on notice. Make sure that I fully understand how you're describing people and how they have potentially interacted with each other, and then we'll give you as much information as we can.
Is it worth hearing from Jerome on the lines of
It's.
inquiry?
I'd walked off, and you called me back. So I think it's very much worthwhile hearing from Jerome, for as long as you'd like to. But is there any more for me on any matters? Well, Jerome it is.
Can you please expand on, if you can, the lines of inquiry which Trevor has mentioned, both on the testing worker interacting with the teacher,
Yep.
and then just any new information you've learned since we last spoke on any of the cases, workplaces, contact, where they
Sure.
were, all that kind of stuff.
Sure. Okay, well, it's been all of, I think, 4 hours since we last spoke around the cases, but let me give a quick run through where we're at the moment. So we have a case, an unlinked case at this point in time. There's a man who lives in the city of Maribyrnong. He's the one who works in a warehouse in Derrimut. We have tested his housemate that he lives with. We're awaiting results for that test. He also has a number of relatives who live in other properties. We are testing those relatives at this point in time. That's one of our lines of inquiry at the moment, that it runs through potential connections with their relatives. There is a potential further link on to another set of relatives who have come back recently from Sydney. That is a line of inquiry that we're following at this point in time. We're expecting testing results in for that cohort over the coming nights, probably in the early hours of tomorrow morning. That will give us much more information about where that cluster has got to. The other cases from last night, so 2 positive cases, a couple who live in the city of Hobsons Bay. One of those is a teacher at Altaqua College. The other is somebody who works in Caroline Springs. They've both tested positive. We've known about them for just over 24 hours now. We have other relatives of one of these individuals who live in Altona North. Those relatives have all been tested. It's 2 older adults and 3 younger people. All those 5 have been tested. 2 of them have currently tested positive. One of the elderly residents of that household, one of the younger residents of that household. We're awaiting test results for the other 3 at this point in time. We're of course then doing a lot of testing around the workplaces in Caroline Springs, workplaces in Derrimut, workplaces around Altaqua College. A lot of fantastic response, particularly today and yesterday, from the school community around Altaqua, similar as we've seen from other school communities in recent outbreaks. So great turnout last night at the testing stations and again today. And again, my message, just to add to the Premier's message, if you haven't got tested yet today because you thought the queues were a bit long this morning, they're not long now. We had 3-hour queues in some of our Western testing stations this morning. They're now under 1 hour. So please, the testing stations, the larger ones, are open until at least 8 o'clock. We've extended operating hours at over 13 of our testing stations, and we continue to provide dedicated testing facilities at some of those key exposure sites.
What about the potential link between Old Tukwah and the traffic control?
Yeah, look, so there's a, we've heard a story going the rounds around allegations of illegal parties. We've tested those with all the individuals in these outbreaks. None of that, there's no evidence forthcoming. There's no indication that any such event happened. We'll continue those explorations, of course, but with nothing else to comment on that point.
Do you have any idea with the Hobsons Bay topic which was reported first and therefore bringing out people
Yeah, no, good question, Rachel. So we've got, we believe at this point that the female, the staff member at Old Tukwah, was slightly earlier in her infectious period than the man that she lives with. We're obviously very keen to understand, given that their relatives in the other household are also positive, the timing of that. So we are doing ongoing genomics, and also we'll check to see what the phasing of that transition might have been.
No indication that teacher has a link to the Moonee Valley case at all?
No, Julia, not at this point. So again, we've not established any epidemiological link between the teacher or between that Hobsons Bay cluster and any of these other larger outbreaks that we've seen recently. Again, but those conversations continue. So we now have 5 positive cases who are going through repeated interviews and discussions. People are sharing a lot of information. We're going through all their movements, and of course we're checking back with other associated people or other people who've been in those geographies in some of those vicinities in the previous outbreak.
And if I got that right, you're saying that the unlinked case from Maribyrnong
Yep.
and also the football case both visited other households?
So our understanding at this point in time is that there has been some household-to-household contact. Again, we haven't confirmed exactly where and when people saw each other, but we do believe there's been some contact.
Have the New South Wales relatives for the City of Maribyrnong case visited? Have they been tested yet?
So those tests are on have been done tonight, and we're waiting for results overnight.
Are they gold, red zone holders, or are they in hotel quarantine?
Don't have the information on that, Paul. We'll look at this point in time. I think, with all due respect, there's a number of lines of investigation that we're following through. This is one of a number of lines. We'll continue to explore that and all other options at this point in time.
So the exposure site added for an observation
Yeah.
that Tuesday
Yeah.
last week, like this afternoon. Does that mean that you now believe that the male member of the couple was infected way back then?
Yeah, that's right. So one of the both cases from Hobsons Bay have infectious periods that we've been very conservative around that, as you would expect us to be with Delta. We've taken it all the way back to the 28th of July.
I think Tuesday was
Could have been. I can come back to you on that if you need to.
Just on, if I could say, just in relation to the New South Wales HQ issue, I hope that isn't the case. No one's barracking for that outcome, but it is one of the lines of inquiry we're running to ground. Hopefully it comes to nothing. And we'll know once we get tests.
But is a lot of inquiries that they were in New South Wales hotel quarantine, or they came to our hotel?
No, they were in New South Wales hotel quarantine. They were cleared out of that. They came to Melbourne, and they've had contact, we believe, with one of the positive cases.
How many days after that?
We're not certain. So I think the best thing to do is let's and look, I mention it simply because it is a line of inquiry. You asked me about lines of inquiry, and I wouldn't want you to think that I wasn't answering you fully. Hopefully it comes to nothing, and we'll know that. And believe me, if it does, I'll be the first to say so once we get the test back. Genomics will also help us have a clearer sense of exactly where this has come from. No one's alleging anyone's done anything wrong in New South Wales or anything like that, but that's just the way you asked me the question and I answered it. Beyond that, if you can help us get that information out about payments, that'd be a great help. And if I can just again, for those who are watching live, get tested as soon as you have symptoms. And don't wait an hour, let alone 3 or 4 days. Please get tested as soon as you have symptoms. We will protect and support you, and in doing so, you will protect and support all of us. These next few days will be very tough, but we've done it before and we can do it again. That's what we're made of. We are very tough in Victoria. We will get this job done, but only if we all play our part, including you guys. So thank you very much. Cheers.